Hi, I'm Dr. Bhargav Raut from Pathavast Lab in Pune. If you have symptoms like cramps in your muscles, or maybe you feel thudding or fluttering in your chest because of an abnormal heartbeat, or maybe you feel excessively thirsty or you need to visit the washroom all the time because of too much urination, then your doctor may recommend something called the electrolytes blood test or the serum electrolytes test. And today I'm going to tell you everything about this test. So what are electrolytes? Electrolytes is just a fancy word for the salts in your blood. So the salt that you have when you have a meal, the salt, the simple table salt, that contains the sodium and the chloride. Sometimes it also contains the potassium. The three are the main electrolytes or the charged molecules in your blood, the charged minerals in your blood. These are sodium, potassium and chloride, and sometimes we also add bicarbonates into this test. So the electrolytes are basically these salts, sodium, potassium and chloride and bicarbonates, and these are very important because they are needed for the proper functioning of your nerves, your heart as well as your muscles. They give you the blood pressure that you have. The normal blood pressure of a human being is completely dependent on having enough salts in your blood. They are extremely critical to maintain a proper balance between your cells and your body fluids, and so electrolytes are probably one of the most important things in your blood, and that's why it's critical to get these tested. So what does the electrolytes blood test do? So the electrolytes blood test measures the levels of sodium, potassium, chloride and bicarbonates in your blood. Some labs will only include sodium, potassium and chloride. Bicarbonates are not always included because sodium, potassium and chloride are the major ones. A machine will automatically measure the levels of these charged substances in your blood sample, and just a single sample of blood is required. So what are some of the symptoms that may mean that you need an electrolytes blood test? So these include feeling tired all the time or fatigued, muscle cramps, weakness, confusion, feeling disoriented, nauseated or you're vomiting, irregular heartbeat, dizziness or vertigo and numbness. All these are a non-exclusive list of symptoms that may mean there is something wrong with the salt balance in your body. What are some of the main aims of doing this test? So the first is dehydration assessment. Doctors want to know whether you're drinking enough water and salt. If you're not getting enough of these, your electrolytes will probably be low, and this could be the reason for your symptoms. Number two is kidney function. The kidneys are the most important organ in the body that actually control the level of electrolytes in your blood. If you have a kidney disease, your kidneys might be losing electrolytes into your urine and your electrolyte levels will suffer. So checking electrolytes is a good way of checking your kidney function. Third is medication. Many patients are on medications for things like high blood pressure, which actually lower the levels of salts in your blood and thus reduce the blood pressure. But if you take too much of this, your electrolytes can become too low, and so monitoring electrolytes helps us to know whether you're having the right levels of your medicines or not. Thirdly, heart monitoring. Patients with heart diseases or abnormal heart rhythms called arrhythmias are susceptible to being very sensitive to abnormal electrolyte levels, and so this is a test that is commonly advised in people with conditions like heart failure. Lastly, acid-base balance in patients who have diabetes, or even in those who have other diseases, in those who are critically ill, people who have sustained burns, those who have had a major accident, or people who have been through heavy surgeries. All these people have to have their electrolyte levels and acid-base balance in the body maintained properly for good recovery, and so this test is usually recommended. How is this test done? It's a simple blood test. A single sample of your blood will be drawn from the vein in your arm and it will be processed in the lab. You should have the results usually within a couple of hours. It is important to note there are no special precautions before getting this test. You can do it at any time of the day. You don't need to be fasting, and you can take all your usual medicines. Important to note that if you're on a class of medicines called diuretics, which are usually given to people who have high blood pressure, these diuretics can alter the levels of electrolytes in your blood, so please inform your doctor about this. The unit of measurement is usually millimole per liter or MEQ per liter, and this will be mentioned in your report. What are the normal ranges of the different electrolytes in the blood? So sodium should be between 135 to 145 millimoles per liter. Potassium should be between 3.6 to 5.2 millimoles per liter. Chloride should be between 102 to 112 millimoles per liter in those who are less than 17, and it should be between 98 to 107 in adults. Bicarbonate is usually between 22 to 29 millimoles per liter. And lastly, there's something called an anion gap, which is something that your doctors will interpret. I've also mentioned the normal range over there. It depends on the relative balance between these different electrolytes. So what are some of the reasons because of which your electrolyte level might be abnormal? The first and most common is dehydration. If you haven't had enough water and salts to drink, or if you have been vomiting excessively, you've had severe diarrhea, or you've been sweating a lot, maybe you went for a marathon and didn't hydrate well enough, well, this is the first and most common cause of low electrolytes. Dehydration, that is not enough water and salt intake. Number 2, kidney diseases. If your kidneys are failing, if your kidneys are not working properly, they're not going to be able to maintain the appropriate levels of salts in your blood, because the entire control of maintaining salt balance in your body depends on your kidneys. If your kidneys don't work properly, your electrolyte levels will suffer. Third is heart failure. This is a complex condition in which a patient's heart doesn't beat effectively, and this gives rise to a series of events, all of which feed into each other and eventually cause a complete derangement of electrolyte levels, especially sodium. And so you should definitely get this test done. And if you have heart failure, yes, it's likely your electrolyte levels will not be normal. Diabetic ketoacidosis is a very severe complication of diabetes. When a patient's sugar is completely out of control, his body doesn't metabolize it correctly, the body begins to break down proteins and starts using them instead of the sugar for energy. This changes the acid-base balance in the body and is a pretty serious condition in which you need immediate medical attention, and yes, it will cause a complete derangement of your electrolyte levels. So if you're a diabetic, something to remember. Last, some medicines which cause loss of salts, or they cause your salts to be retained excessively, or they could damage your kidneys, and that could cause your electrolyte levels to suffer. So you should always know which medicines you're taking and whether they can affect your electrolyte levels or your kidneys, and discuss this with your doctor.